Congratulations, you've just had a positive pregnancy test. What happens now? What do you need to do? Stop, relax, watch to the end of this video and I'll tell you everything you need to know about this exciting next few weeks of your life. The first step when you have that positive pregnancy test is breathe. There's nothing that you need to do immediately. Enjoy this moment. Think about what it means. How do you feel? Are you happy? Are you sad? Do you need to tell your partner? Do you want to tell anybody else? I think the old days where you've got to keep this information news to yourself for the next 12 weeks until your first pregnancy scan is long gone. Tell whoever you want. There should be no taboo. If you're worried, if you're scared, if you're anxious, if you've been through a miscarriage before, you may not be feeling all those happy feelings. So you might just want to take a little bit of time with someone you can trust and who you can speak to discuss this news. So don't worry. There's nothing you need to be doing right now. It's day one after your positive test. The main thing you need to be thinking now is, I'm pregnant. What changes do I need to make in my lifestyle? Maybe this is something you've been planning for a while. You already cut out alcohol, any other kind of drugs. But if this was unexpected for you, if you're not even sure what you might do next, if you want to keep the pregnancy, if you don't, make some of those little changes that you need to do. If drinking is a big part of your life, thinking about swapping out your alcoholic drinks for non-alcoholic alternatives, trying to get a bit more rest, make sure you're doing some regular exercises. All these things will help you to have a healthy pregnancy. Adjust your caffeine intake. Now, no guilt, no worries. If you didn't know you were pregnant, you found out slightly later on, you've been drinking coffee already. This is a new start for the rest of the pregnancy. So ideally you want to restrict your caffeine intake to about 200 milligrams a day. Generally, that means one latte from a shop should be okay, but anything more than that, you should swap out for a decaffeinated alternative. Another thing you should be considering is, do you take regular medication? If you do, you want to make sure the medication that you're taking is safe for pregnancy. So give your doctor a call, have a look at the medication on the BUMPS website. It's a fantastic resource for working out if you can take medication safely. And the third thing I want you to consider is, are you taking any supplements? Again, you might have been taking them already, but if not, it's a really great time now to start taking folic acid and vitamin D. They're the only things you definitely do need. If you want to swap your pre-pregnancy vitamins to a pregnancy multivitamin, go ahead. But what you want to make sure is that you're getting your daily dose of folic acid and vitamin D. Fourth thing to do is calculate your potential due date. So for this, you need your menstrual diary. Hopefully, if you're already keeping a menstrual diary, you know exactly what day your last period started. But if not, try and think about it. And if you have absolutely no clue when your periods, where your cycles are really irregular, then this is a reason in order to get an earlier pregnancy scan to work out when your due date might be. But otherwise, you can use the NHS online or any online due date calculator. Put in your date of your last period and you can work out approximately how far along you are. The next step, and again, there's no rush to do this, you don't have to do this on the day you find out you're pregnant, is to think about booking your pregnancy. Now, if you live in the UK, you can choose which hospital you want to give birth in. So what that means is think about which hospitals are local to you, asking your friends where they had their babies, if they had a good experience or not. And then you usually, nowadays, can go online and refer yourself to your local hospitals. That means booking your pregnancy online. But if you're not sure, or you want to ask your own doctor, then you can call up, have a telephone appointment or even a face-to-face appointment with your GP, your doctor, and they can direct you how to book your pregnancy. This means you then have an appointment with a midwife. You run through all of your previous pregnancies, your previous medical conditions, any surgeries you might have had. So they collect all the information they need to know about you for looking after you for your pregnancy, and then also give you a date for your upcoming scan. You'll notice that usually the first scan you're given automatically will be at 12 weeks. This might feel like a million years away from where you are right now, but take a breath. You don't need to have a scan any sooner than 12 weeks unless you experience a lot of pain, you're worried that your pregnancy might not be in the womb, it might be outside of the womb. That's called an ectopic pregnancy. Or if you're worried that you have started to have bleeding. Now, bleeding in pregnancy should never be ignored. So from now, when you're having had a positive pregnancy test, you'll be waiting and seeing, and if there is any bleeding, this is something you should discuss with your doctor, and potentially they'll perform a scan for you earlier than 12 weeks. But otherwise, it can feel like a very long stretch of time, but you want to try while you can to enjoy it. You might also notice over the next few weeks you start to develop some pregnancy symptoms, so you might have them already. Nausea and vomiting are common. They don't just occur in the morning, and I'm going to do a separate video about morning sickness and how best to control that. But if you're struggling with morning sickness already, discuss it with your doctor and don't be afraid to take medications if needed. It is safer to take medications in pregnancy for nausea and vomiting than to allow yourself to become so dehydrated that you need to be admitted to hospital. So you can discuss those options with your GP as well. Make sure you subscribe and check out the rest of my channel, because you'll see this video is part of a totally free series of antenatal classes. All of these videos are ready to get you and your partner geared up and prepared to become parents.